Hello, my name is Persaud. I'm a consultant psychiatrist.
My name is Jeremy Coid. I'm Professor of Forensic Psychiatry at Queen Mary University.
Why is it that that's the particular branch of psychiatry that would be particularly involved in a case like Anders Breivik?
A forensic psychiatrist, I think it's important to say, forensic psychiatrists differ somewhat in different countries. All psychiatrists who are required to give evidence to the court, usually in criminal cases, but in other cases as well. And so court work and advice to the court as an expert witness is the sort of hallmark of a forensic psychiatrist. But let me say one more thing. The way you give evidence, the way you make your diagnosis is also affected by what else the forensic psychiatrist does. So you could compare at one end of the spectrum, someone like China, where forensic psychiatrists have no responsibility beyond giving an opinion to the court. They do not look after those individuals after sentence is passed. At the other end of the spectrum is probably a country like the UK or maybe Germany, where in fact their evidence and what they say has quite a bearing on what happens next. And I believe that influences the way that they give opinions and also evidence to courts.
So in a case like Anders Breivik, you would have been involved in assessing people that might not be dissimilar in some sense in terms of the psychology of the situation?
Yes, indeed, I would. And in certain circumstances, so for example, I worked in a high secure hospital, I might have even ended up looking after him, were the court to determine that he went to a special hospital.
Why is that experience that you've got with that kind of person important in terms of lending added weight to your assessment? Why is it an ordinary psychiatrist couldn't make the assessment, or an ordinary doctor, or a member of the lay public?
Well, I think because you actually see cases like this, I mean, most psychiatrists will never see such a case in their career. During your career, you should have seen 2 or 3 cases in this country. I've certainly seen 4 or 5. Not as many people victims, of course, as Breivik, but having seen such cases, that will influence the way you perceive them.
How does a forensic psychiatrist go about assessing someone like Breivik?
Well, the first thing you do is you look at the evidence. You look at, before you even see them, you should read what it is that they've done and what they've been described as having done. I think that's the number one thing. So you're really aware of what it is and what it is they've said to. I mean, often the most important interview in many of these cases is the interview with the police, assuming they've survived and they are actually interviewed by the police. That will tell you an awful lot about the mental state close to the time when they've actually committed the offence.
Why is that so important, to try and get some evidence of what they were like close to the event as opposed to many weeks or months later? Because
everybody knows that psychiatry can sometimes be used for what the lay public might see as getting people off. They're actually pretending, falsifying or exaggerating symptoms, or saying symptoms were relevant, even that they might actually genuinely exist, but relevant to the offence.
So you're very interested in what happens in the police interview,
yes,
or any evidence about the behaviour and the thoughts of the person, or
yes,
what they said around the time of the crime.
Yes.
But later on, what are you interested in? For example, when you conduct an interview with someone like this, what sort of questions would you ask?
Well, what I personally do is run through the offence with them. You might, personally, the choice is to actually do that early in the interview and then again at the end, run over it. And in between, somehow sandwiched in between that is often the sort of life history, family history, other psychiatric history, and looking at symptoms. But having got that, one might want to go over it all again. But you do that having got the evidence that's available beforehand, and so you're sort of cross-checking in your mind always what it is that you know from collateral information on what that individual has done and what he said he has done and why he said he's done it. Often police, of course, they're not so interested as you are about motive, and motive is enormously important, of course, in cases like this.